Hi, I'm Sally Edgington, Chief Executive Officer of AXREM. Radiotherapy is a word that can carry weight, uncertainty and emotion. At AXREM, we believe in replacing fear with understanding by showing the people, the technology and the care behind every treatment. This video has been created to offer clarity, comfort and connection. It brings together voices from across our membership and the patient community to demystify radiotherapy and highlight the extraordinary engineering and human empathy that shape this experience. You'll hear from experts who design and build the equipment, and from Andy Tudor, a patient advocate whose honesty and insight remind us why we do what we do. Whether you're a patient, a loved one, or simply curious about how radiotherapy works, this film is for you. It's about making the invisible visible, showing how innovation, precision and compassion come together to support people at one of the most vulnerable moments in their lives. We're proud to share it with you.
So radiotherapy is a form of cancer treatment that uses high energy X-rays to destroy the cancer cells. It's planned by a specialist team in the hospital using the CT or the MRI to really make the dose really precise to treat the tumour. It's delivered over several fractions or treatment courses, and that allows us to build the dose within the tumour without harming the healthy tissue.
Hi, I'm Andy Tudor and I've successfully received radiotherapy. 8 years ago I was diagnosed with a brain tumour which was surgically removed. And then 3 years ago I was diagnosed with a second brain tumour which was successfully treated with radiotherapy. The reason I'm doing this video is because prior to my treatment I didn't feel I had the right information or enough information to really make me feel happy with what was happening. I didn't know what was to expect, and that added to my anxiety. So if by doing a video like this I can help explain to others what to expect, hopefully demystify it, take some of the scariness out of it so that people, when they receive their treatment, they know what to expect and they'll feel a bit more relaxed about it, then I'll feel like I'm doing the right thing. And that's why I get involved in advocacy for radiotherapy, so that I can hopefully help others going down the same journey as I went through.
A radiotherapy machine is a linear accelerator. These machines are very big and are housed in very large rooms. The electricity is used to create the beam, which creates a sort of a buzzing sound that the patient will hear. The machine doesn't touch you and the patient doesn't feel anything throughout their radiotherapy treatment.
Radiotherapy is a form of cancer treatment that uses high energy X-rays to destroy the tumour. A team of specialists in the hospital will use the CT or the MRI to plan the treatment to really sculpt the dose and get the dose within the tumour and avoid putting dose into the tissues that surround the tumour. Radiotherapy is generally given over fractions, and again this allows us to build the dose up while preserving the healthy tissue. Radiotherapy can be given externally using a machine called a linear accelerator, or we can put the radioactive source into the actual tumour itself, into the patient, and this is called brachytherapy.
As manufacturers, there's lots of things that we have to consider beyond just the treatment devices themselves. We look at ancillary devices such as surface-guided radiotherapy, masks and other immobilization equipment that are there to increase the accuracy and efficiency of the treatment while also balancing the patient comfort. Surface-guided radiotherapy, for example, is there to enable tattoo-less treatments for a number of patients, and this is being implemented widely across the UK as we speak. When your treatment starts, often we will image your position to ensure that you're in exactly the right place. Once this image is done, it has to be reviewed by the team on site, and it may feel like nothing is happening. At this point, what the staff are doing is making sure we have you positioned exactly where you need to be, and any minor corrections are made before the treatment starts. Typically, your treatment will take around about 15 minutes, although some more complex treatments may take even longer than that. Radiotherapy is evolving incredibly quickly, and as manufacturers we play a key part in that. We're constantly striving to innovate and create a technology that is both more impactful for patients, more efficient and a better experience. Year on year we bring new technology that can speed up treatments, improve outcomes and make the experience better for patients.
When I had to receive radiotherapy treatment, when I was told, the first thoughts, it's a 4-letter word. I better not repeat it here, but it's scary. It's pretty unpleasant because you know something is probably seriously wrong that you need radiotherapy for. So in my mind it was, and I didn't know about radiotherapy either. So it was opening up a big, scary new world that I didn't know much about, and not very pleasant at all. I was given very little information, and that's one of the reasons why I'm doing this video, is if I can help others. So I didn't get much information. I was told about radiotherapy by a consultant, so it was big, scary words, lots of medical expressions. I was given a 2-page list of what it is and what it isn't, which wasn't how I like to receive information, so that was a little bit, it felt old-fashioned, and I'm thinking, what treatment is this? One of the instructions, or one of the bits of information, was the fact that you won't be radioactive after you've had the radiotherapy. I never even considered being radioactive. I'm thinking, what is this stuff? So I was given very little information, and I would have so wanted to see a video like this or other videos explaining what it was and what it wasn't, so that your mind doesn't race and think, is it this, is it that? The information I wasn't given was minimal. And I was pleasantly surprised, actually. I was led into the room, the treatment room itself. The equipment wasn't as scary as I thought it would be, and that's the first time I'd seen the equipment as well, so that was a bit of a shame. So actually I walked in thinking, oh, this isn't quite as bad, because I'm used to MRIs where you're in a machine that's very closed in and you can feel claustrophobic. You don't feel that at all with the radiotherapy treatment and the treatment rooms. It's a big, wide room. The equipment itself is quite large, but it's not close to you. So when I walked in, I thought, actually, do you know, this probably isn't as bad as I was anticipating it was going to be bad. And the treatment team were really good at explaining what was going to happen, what wasn't going to happen, and in the end, I was actually pleasantly surprised how not easy it was, but how easy it was to actually get into the place, access the equipment, and it was just much less scary than I thought it was going to be. That was fine. So in my case, I was treated for a brain tumour, but it was using the same sort of equipment that treats all the other cancers. So once you're in place, it's not too bad, because by then they've explained what's happening. The team, they're really good. They've explained that you'll be put in place. The treatment itself didn't last that long. They go out of the room, and that's fine, because they need to monitor what's happening, and they can't be in the room as well, because you know the radiotherapy itself is quite strong, and it needs to be strong because it's hopefully killing off your tumour. So the treatment itself, in my case, lasted about 20 minutes or so, and it was absolutely fine. I didn't feel uncomfortable at all. The actual where you're laying down, you've got sort of rests for your knees and for your head, so you feel very comfortable. And it was all fairly relaxed, if that's the right word. Not a thing. I was concerned actually whether the machine was switched on, because I didn't feel a thing. So I was treated for a brain tumour. I was told, and then with other tumours, that you can feel heat around where you're being treated. But I did not feel a thing. Didn't even know the machine was on. You don't feel any pain at all. You don't feel discomfort. The only discomfort you get is the fact that you're on the table and you have to be immobilised, which, depending on what cancer you have, that can be more discomfort than other cancers. Some cancers more than others, but you don't feel a thing during treatment. It's quite remarkable. It's really good. No, not at all. I mean, by the time the team had explained why you're alone. So the reason you're alone really is because the radiotherapy itself is very strong. And it has to be very strong because it's killing off tumour cells, hopefully, or whatever it's treating. So they have to leave the room. It's a bit like when you go to the dentist and they take an x-ray of your teeth, they leave the room. That's absolutely right. And in a way, it's a comfort to know that you're being treated by radiotherapy that's strong enough to hopefully be part of the cure. So they've explained that they'll need to leave the room to monitor what's going on, to check you're in the right place, to make sure the machine is doing what it should be doing, to make sure that the right part of you is being irradiated, because that's obviously the most important piece. So the fact that you're on their own, and what I was told was, even though I was immobilised, sort of head and neck, if I had any issues at all, just put my thumb up. I said, so if you put your thumb up, they can see you at all times. That's important to know as well. So they said if you feel any discomfort or if something's not quite right, just put your thumb up and they'll be straight in and talk to you. And also they're talking to you over the intercom. You can also have music on as well in the treatment room I had. So I think the treatment team was subject to some quite unusual music because of my music choices. But again, that adds to the comfort of being in there. So no, being alone, I've heard other people say this is actually quite nice because you get 20 minutes, half an hour to yourself. It wasn't really described, to be honest, before the day itself, so I wasn't quite sure what to expect, which again, hopefully this video will help address. And so it was different to what I expected, and that it was actually easier. I didn't really know what to expect. So your mind races about what might happen. You're used to MRIs, which are quite uncomfortable. So the actual day itself was a lot easier than I was expecting. And I've heard other people who've had radiotherapy for different types of cancer say exactly the same. The actual treatment itself is a lot easier. Now everyone's different, and I can't say everyone's treatment will be easy, and it can be tough still, and it's just, there can be discomfort, so I'm not sugarcoating it, but the actual treatment itself I found on the day was a lot easier than I was anticipating. Very few. So I was treated for a brain tumour, so I lost my hair over where I was irradiated, and it was sort of up there, about the size of my palm of my hand. But that, for me, that was quite good because I genuinely didn't know whether the machine was switched on because it didn't feel a thing. So when my hair over that patch fell out about 10 days later, I thought, oh, the machine was switched on. So in a way, that was quite good. And my hair grew back within about a month, and it's been fine ever since. So also, and this happens to a lot of patients who have radiotherapy, for about a week to 10 days, you can feel fatigued, extra tired. If you have a series of radiotherapy treatments, a lot of people have sort of maybe up to 30 in one large session, then the fatigue can build and it can get worse, and then it can also, the fatigue can be around for about a week or two after your treatment finishes. However, that's the only side effects, and I think most people having radiotherapy, by the time you need it, you're used to fatigue, you're used to feeling extra tired. So you don't, not that you don't mind it, but if that's as bad as it is, and also because the radiotherapy is planned, you can plan around your life around trying to do as little as possible on the days you're treated or the sort of the week or two afterwards to mitigate the fact that you'll feel fatigued. But other than that, now I had surgery to remove my first brain tumour, and the side effects from that were significant, and I'm still feeling them to this day. There was nothing extra side effects wise from my radiotherapy, so after a couple of weeks it's as if I hadn't had it. For me, I had surgery to remove my first brain tumour and then radiotherapy to treat my second one. So the benefit for me, the radiotherapy was far easier, both in having it and the side effects were much more minimal. So I was lucky, if that's the right word, that I found radiotherapy to be far better than surgery. So I've also talked to a lot of people that have had chemotherapy, and I know radiotherapy is far easier than chemotherapy as well. So what I would say, and that's why I'm here doing this, I'm a massive advocate for radiotherapy because it is far easier and better to deal with than surgery or chemotherapy. So if you're told you need radiotherapy, try not to be concerned about the actual treatment itself or anxious about it. It really is quite easy. I know everyone's different, but in my case it's quite easy and there's nothing to worry about, nothing to be anxious about. So I would recommend it. If that's what you're told you need, then please go ahead and do it.